During this global pandemic, the world, for the most part, has looked to the World Health Organization for guidance.
The World Health Organization launches a collaborative project to find a vaccine and treatments.
The World Health Organization warning young people they're not invincible.
The World Health Organization officially announced that this is a global pandemic.
Instead, it's found controversy.
Where President Trump does find fault in handling the pandemic is the World Health Organization.
You know, right now they're literally a pipe organ for China. That's the way I view it.
He accused the body of being too trusting of China's assertions that it had the virus under control.
They not only need to answer to the needs of over 100 member states, but the whims and politics of the countries and organizations that donate the lion's share of their budget. This is the story of how the WHO tried to please the world and ended up losing its biggest backer. The World Health Organization was founded in 1948 by the also newly formed United Nations.
Czechoslovakia, Yugoslavia, Denmark, Greece, Poland, Hungary, and many other nations have benefited from WHO.
Headquartered in Geneva, they were tasked to mandate and coordinate health policy.
Initial vision for the World Health Organization was not only to make it an important agency focusing on health issues and disease outbreaks, but to try to create a form of international cooperation and collaboration that would bind the nations together.
And in the coming decades, the WHO has taken on a dizzying amount of missions, from world-altering ones like the eradication of smallpox and the identification of HIV, to awareness campaigns like safe driving, suicide prevention, and anti-smoking PSAs.
Well, there are several main roles. So one is to what they call its normative role, which means it sets standards for medical matters throughout the world. And it has an important role in providing technical support to low and middle income countries.
In order to tackle all of those initiatives, the WHO has become an incredibly complex organization. There are 6 regional offices around the world: in Congo, Denmark, America, India, Egypt, and the Philippines, all of which report to the headquarters in Geneva.
Each of which has its own mode of functioning, bureaucratic staff, and the like.
The balance of authority between the regional offices and the headquarters in Geneva has always been slightly problematic to get them all reading from the same page when they have different regional constituencies.
And within those regional constituencies are 150 country offices. In order to run all of those offices requires a great deal of money, originally in the form of assessed contributions, or dues, by the member states.
Assessments were determined by the overall GDP or economic strength of that particular country and its population. There was some formula worked out.
And that formula worked for a while. Member states paid their dues, the WHO provided guidance for health issues around the world. But over the last 3 decades, that amount of money declined and is now only about 20% of its overall budget. Today, the WHO is mostly funded by voluntary contributions, with the United States being by far the highest paying contributor, followed by the organization started by this guy.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
And when and where the WHO gets its money from influences so much about what it can do.
And the Bill and Melinda Gates Foundation can say, through our extra budgetary funding, we're like so much invested in polio. No one can tell us not to do that. And that has made the WHO a very unbalanced and complicated organization.
That unbalanced and complicated bureaucracy has consistently been one of the World Health Organization's biggest criticisms. But they've also been criticized for how they've reacted to the past 2 major epidemics before COVID-19.
We've now seen another outbreak of SARS, potentially we've seen a cluster and transmission of the SARS virus.
In 2003 was SARS. The WHO was criticized for overreacting to the disease, which only had 774 known deaths, but ended up costing East Asian countries over $20 billion in lost GDP.
Hotels, tour agencies and travel companies are reported to have suffered huge losses during the outbreak.
That led to an underreaction in the response to the Ebola epidemic in West Africa in 2014.
The big decision before them, whether to label this worst ever Ebola outbreak a, quote, public health emergency of international concern.
It didn't get a grip on the situation. It delayed in calling this public health emergency of international concern.
The head of the World Health Organization, Margaret Chan, she has experience dealing with outbreaks like bird flu, like SARS. Shouldn't she have been handling this better?
And so it was a general mess, which led to many investigations afterwards about the WHO's very slow and inefficient and inadequate response.
So with the overreaction to SARS and underreaction to Ebola, COVID-19 was a chance for the WHO to finally get things right. And initially, everyone seemed happy with their performance.
COVID-19 is a real threat. It is a real threat to everyone on the planet.
It took the WHO 1 month to declare COVID-19 an international health emergency. Compare that to the 4 months it took them to call Ebola an international health emergency. And Trump, who originally praised China and the WHO's response to the pandemic.
So far, I think China's been trying to be, or at least they seem to be trying to be, somewhat transparent with us.
He later turned on a dime, blaming not only China for the pandemic, but the WHO as well.
The WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China for its so-called transparency. I don't think so.
This was partially a response to the WHO Director General Tedros Adhanom Ghebreyesus' constant praise of China during the pandemic.
I will praise China again and again because its actions actually helped in reducing the spread of coronavirus to other countries.
China, as well as critics of Trump's administration, say Trump shifted the blame for domestic political reasons to divert attention from his catastrophic failure to address the crisis in America, whether it be from initially downplaying the virus.
In this big, vast land of ours, this great country of ours, we have 240 cases. Most of those people are going to be fine.
To touting unproven treatments.
A drug called hydroxychloroquine. And it's shown very encouraging, very, very encouraging early results. I think it's going to be great.
All while the death rate in America surpassed that of the rest of the world. And even though there are accusations that China has not been transparent about their numbers of COVID-19, Tedros and the WHO were presented with an impossible decision.
This is international health diplomacy. The WHO has no power of enforcement. They cannot dispatch a team against a country's wishes. They're dependent on data coming out of that country with a presumption that countries will cooperate.
In no situation could the WHO please both the US and China, and that resulted in Trump taking punitive action.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess mismanaging and covering up the spread of the coronavirus.
And remember that chart for who funds the WHO? It's not just a huge loss for the organization, but for poorer countries around the globe.
Every one of the essential functions of the WHO would be immediately challenged and threatened, if not stopped.
And while America has the CDC to create their own guidelines and best practices,
countries in Africa and other parts of the world don't have those resources and are desperately dependent upon the WHO to provide equipment, information, interventions. And now those will be seriously challenged, if not stopped completely.
So where does this leave the World Health Organization right now? Apparently, it's not up to them, but us.
Reminded of a quote by Larry Gostin, who was one of the international health experts who was very important in the WHO. He has said, the world has gotten the WHO that it deserves. The world has created this organization with all its faults, flaws, inconsistencies, and inefficiencies. Can the world wake up? Can this crisis force the world to say we really do need a well-functioning, and truly neutral world health body that will not be beholden to various financial interests or political interests. And out of crisis can come not only disaster, but hope and a new beginning. Will the world let it?